If you've had a hip replacement and no one told you this, you could damage your new hip. As a physical therapist, I've treated over 100 patients post hip replacement in 2025. One of the most important factors for successful recovery after hip replacement is compliance to the post-op hip precautions. Patients often ask me, what are hip precautions and why are they important for recovery? These post-op precautions are important for a couple reasons. The main reason is the one that people fear a lot. So I have a lot of patients who always tell me, oh, I'm very scared that I'm going to move a certain way or I'm going to bend a certain way and then I'm going to pop out my new hip replacement. So the main reason that you want to be compliant with these hip precautions is to avoid any sort of dislocation of that new hip. So for the anterior approach is what we're going to talk about. There are certain movements that you definitely want to avoid and certain positions that you want to avoid to reduce or prevent any of this possible hip dislocation. Now, the second reason you want to comply with these hip precautions is you want to allow and provide the environment for this injury, these tissues that went through all this trauma from the surgery. You want to allow them to heal. You want to avoid any excessive swelling, inflammation, or any unnecessary pain. So doing certain movements while, for example, like the skin and the incision, while those are healing, any excessive stretch or tension on those structures while they heal, you want to preserve that and you want to provide the appropriate environment for those tissues to heal. So what are the specific precautions for anterior hip replacement? The number one position / movement that you want to avoid with anterior hip replacement is having your operative leg, so that same side leg, go behind your body, especially with that foot pointed out. So those toes pointing out. So the reason why you want to avoid that is because with that anterior approach, the incision is right in the front of the hip. So you can imagine once you kick your leg back, and don't do this, but if you were to kick your leg back and rotate it out to the side, you're going to put a lot of stretch, for example, on that incision in front of the hip. You know, you're essentially putting that at the most lengthened position. And as you bring your leg back, in terms of the hip joint, as that leg comes back, that head of the femur, it kind of slides anteriorly or forward. So as the leg comes back, that head goes forward, which would be the most compromising position in terms of dislocation. So the further that leg goes back, with any external rotation where that foot points out to the side, that head of the femur of that new hip joint is likely going to translate forward, and that would be the main dislocation position. So you want to avoid any position or movement when you're transferring, when you're walking, that causes the leg to go back with the toes pointed out to the side, because then that'll cause that head of the femur to move forward. Now, there are also other precautions that you want to abide by. So, for example, no crossing of the legs, no bending at the hip past 90 degrees. For anterior hip replacement, those are less likely to cause like a dislocation of the hip, but more so for like the proper healing and reducing any excessive stretch or compression on the hip joint. So then you reduce any pain or swelling. So avoiding bending past 90 degrees. So whenever you're trying to bend forward and stand up, or if you're just lying down, trying to avoid crossing the legs while you're at rest. Crossing the ankles is okay, but not crossing your thighs, just to reduce any unnecessary pain and inflammation to the hip. Abiding by these hip precautions is going to be very important for recovery. Now, at first, it's going to take some getting used to because you're going to have to modify your daily routine. Really, the main thing is take it slow. So don't be in a rush to change position or to move. It'll be a lot easier for you to be mindful of the movements that you can and cannot do. If you have any questions, feel free to leave them in the comments below and subscribe to the channel and like the video if you found this helpful.